first lesson, you learned how common diabetes is and what you can do to lower your risk. Well, now let's focus on what happens in your body when you have diabetes or prediabetes. After that, we'll talk about working with your doctor to make sure you're as healthy as possible. So, to understand diabetes and prediabetes, it's best to start with your body's cells. Now, in order to function properly, cells need a source of energy. That source of energy is glucose. It's a type of sugar. Now, as a matter of fact, glucose and blood sugar are basically the same thing, so just to make it easy, from here on out, I'll just use the more common term blood sugar, or just sugar. So for things to work the way they should, that blood sugar has to get inside your cells. That's where insulin comes in. Insulin is a hormone that's made by your body, and you can think of insulin as kind of a key that unlocks your cells so the blood sugar can get in. Your cells then use that sugar for energy. But when you have diabetes, the blood sugar can't get into your cells. There are two possible reasons for this. The first possibility, perhaps there's no insulin in your bloodstream because your body can't make it. The second possibility, maybe there is insulin in your bloodstream, but your cells are resisting the insulin your body is making. So even though that sugar builds up in your bloodstream, it's just not getting into the cells where it needs to be. That means the cells don't have the energy they need to do their job. So can you see why diabetes could be a pretty serious problem? There are three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Then there's prediabetes, but more on that later. In the case of type 1 diabetes, your body can't make insulin. Type 1 diabetes is most commonly diagnosed in children and young adults. People with type 1 diabetes have to take insulin every day in order to live. And the only way to get insulin into the body is to inject it with a needle or, in some cases, an insulin pump. Then there's type 2 diabetes. It's the most common. As a matter of fact, 90% of cases of diabetes are type 2. In type 2 diabetes, even though your body is making insulin, your body's cells are insulin resistant. Now, if the cells are resisting the insulin, that means the sugar can't get into your bloodstream, and so it just builds up. Type 2 diabetes is most often linked to older age, being overweight, and not getting enough physical activity. And finally, there is gestational diabetes, which develops during pregnancy. Fortunately, that usually goes away after the baby is born, although women who have had gestational diabetes are at higher risk for type 2 diabetes down the road. Now, what about prediabetes? Well, prediabetes is when the amount of sugar in your blood is higher than normal, but not yet high enough to be diagnosed as diabetes. Now, as you might have guessed, prediabetes means you are at risk for developing type 2 diabetes. It also means you're at higher risk for heart disease and stroke. But remember the good news from the first video when I mentioned that losing weight, along with more exercise, can delay or even prevent type 2 diabetes. Now, whether you're pre-diabetic or diabetic, it's important that you and your doctor form a good working partnership. So remember these three tips. Tip number 1, see your doctor regularly. It's the only way your doctor will be able to monitor your progress and how well your treatments are working. Tip number 2, ask questions if you don't understand something. And tip number 3, be honest about how well you're sticking to your treatment plan or not, including any lifestyle changes you're working on. Now, because prediabetes is linked to heart disease, you and your doctor will be especially interested in 3 numbers. They are your blood sugar, your blood pressure, and your cholesterol. Now, as you make lifestyle changes to lower your risk for diabetes, keep an eye on these numbers. Now, in the next video, I'll be telling you about the connection between the foods you eat and the role they play in preventing diabetes. I'm clinical specialist Michael Dettner, and I'll see you in lesson 3.